medical misinformation on YouTube. They are currently cracking down and are very serious about this policy. YouTube does not allow content that poses a serious harm by spreading medical misinformation, specifically information that contradicts the World Health Organization's guidance about specific health conditions and substances. This policy includes the following categories: prevention misinformation, treatment misinformation, and denial misinformation, promoting content against what the World Health Organization advises. Now, what this policy means for you: don't post content on YouTube if it includes any of the following: prevention misinformation, information that goes against specific guidance on the prevention or transmission of specific health conditions, or on the safety, efficacy of ingredients of currently approved and administered vaccines. Here are more examples of prevention misinformation. These are some of the following substances and treatments that present risk and harm according to YouTube and are not allowed. So if you're promoting any of these substances on YouTube, review it at your convenience. It is not allowed. Also, claims that there is a guaranteed prevention method for COVID-19, not allowed. Claims that any medication or a vaccination is a guaranteed prevention method for COVID-19, not allowed. Treatment misinformation. YouTube does not allow content that promotes information that contradicts, again, health authorities' guidance on treatments for specific health conditions, including promotion of specific harmful substances or practices that have not been approved by local health authorities or the World Health Organization as being safe or effective, or that have been confirmed to cause severe harm. Here are more examples of what they are stating is not allowed. Claims, again, that contradict the health authorities' guidance on safety, efficacy, and ingredients of vaccine. Content alleging that vaccines cause chronic side effects such as cancer or paralysis, outside of rare side effects that are recognized by the health organization. Examples: claims that the MMR vaccine causes autism, claims that any vaccine causes contraction of COVID-19, claims that vaccines are part of a depopulation agenda, claims that the flu vaccine causes chronic side effects such as infertility, claims that the HPV vaccine causes chronic side effects such as paralysis. These claims are not allowed as part of the misinformation policy. Claims that approved COVID-19 vaccine will cause death, infertility, a miscarriage, autism, or contraction of other infectious diseases. Claims that achieving herd immunity through natural infection is safer than vaccinating the population. Content that promotes the use of unapproved or homemade COVID-19 vaccines, as well as content claiming that vaccines do not reduce transmission or contraction of disease. For example, claims that vaccines do not reduce the risk of contracting illnesses, claims that vaccines do not reduce the severity of the illness, including hospitalization or death, claims that any vaccine is guaranteed prevention method for COVID-19, all part of the misinformation policy. Content misrepresenting the ingredients contained in vaccines. For examples, claims that vaccines contain substances that are not on the vaccine ingredient list, such as biological matter from fetuses. Examples also claims that vaccines contain substances or devices meant to track or identify those who have received the vaccine, claims that vaccines alter a person's genetic makeup, claims that vaccines will make people who receive them magnetic, not approved. Denial, misinformation. YouTube does not allow content that denies the existence of specific health conditions. These policies apply to videos, video description, comments, live streams, and any other YouTube product or feature. Also, YouTube states keep in mind that this isn't a complete list, and it also applies to external links in your content. Denial, misinformation policy. Content that denies the existence of COVID-19 or that people have died from COVID-19. Examples: denial that COVID-19 even exists, claims that people have not died or gotten sick from COVID-19, claims that there have not been cases or deaths in countries where cases or deaths have been confirmed by the local health organization, are all part of the denial misinformation policy, and it's not allowed. Now, YouTube states that they may allow content that violates the misinformation policy noted that we just discussed, but it states here, if that content includes additional context in your video, audio, title, or description. It states this is not a pass to promote misinformation, but additional context may include countervailing views from local health authorities or medical experts. So if you provide additional content, they may allow, but you must be careful, because who knows what is acceptable and not acceptable to those reviewing the video. So if I was you, I would stay away from this misinformation content unless you are specifically sure that you're meeting the exception guidelines. It states that they may also make exceptions if the purpose of the content is to condemn, dispute the misinformation that violates their policy. They may also make exceptions for content discussing the results of a specific medical study or showing an open public forum like a protest or public hearing, provided the content does not aim to promote misinformation that violates their policies. YouTube states that they also believe people should be able to share their own experiences, including personal experiences with vaccinations. For example, this means that they may make exceptions for content in which creators describe firsthand experiences from firsthand experiences for themselves. So if you are tracking your own personal experience and you're not promoting misinformation, that may be allowed. At the same time, They do recognize there is a difference between sharing personal experiences and promoting misinformation. To address the balance, they will still remove content or channels if they include other policy violations or demonstrate a pattern of promoting medical information. So you must be careful with that balance. Also, what happens if content violates this misinformation policy? If your content violates this policy, they will remove the content and send you an email to let you know. If they cannot verify that a link you posted is safe, they are going to remove that link. If that is your first time violating their community guidelines, you will likely get a warning with no penalty to your channel. If it is not, they may issue a strike against your channel. And if you get 3 strikes within 90 days, your channel will be terminated. And you do not want that. They may terminate your channel or account for repeated violations of the community guidelines or terms of service. They may also terminate your channel or account after a single case of severe abuse or when the channel is dedicated to a policy violation. So if you make it a habit of promoting medical misinformation or misinformation in general, on the first try, they may terminate your channel altogether. Please share your thoughts on this medical misinformation